Chimes Israel, founded in 1991, helps people with disabilities use their abilities and skills to lead a life of dignity, independence, and community participation. Our 25 centers and programs provide early childhood rehabilitative care, after-school clubs, vocational college, supported employment, adult rehabilitative nursing care, and mental health employment services. The 1,400 people we work with are toddlers, children, teens, adults, and the elderly from all population sectors, regardless of religion, race, or nationality. In Ashkelon, a southern city that's less than 6 miles from Gaza, we provide both early childhood and adult therapeutic daycare services. The Children's Center operates in 4 inadequately repurposed private homes that are full of small rooms and many stairs. During the first 3 months of the October 7th war, thousands of rockets were hurled into Ashkelon. The children could not go to daycare because our safe rooms do not accommodate everyone.
When we were attacked in the beginning, when it started, it was massive. It was horrible. Everybody's anxiety level went to the sky. It was impossible. It was day and night. There was no time to do anything except prepare yourself for the next run to the shelter. This became the Ashkelon of today.
We had a very challenging year due to the war and our situation. My son suffers from renal failure and is treated with dialysis at home every day. Because he needs to be connected to his dialysis machine at night and his feeding devices during the day, I couldn't disconnect him and run to the safe room. It was simply not possible. So there was a lot of stress, and we had to evacuate. When the war began, the educational institutions shut down, and we found ourselves with the children at home. We live in an apartment without a safe room, and that, coupled with the fear of terrorist infiltration, led to our decision to rent another place elsewhere. Eliran moved to an unfamiliar environment. He was out of sorts and would scream all day. It was not easy.
I've been on contacts on phone with some families and helped them only on talkings because I cannot give the children a treatment those days.
We had to develop new methods of reaching out the families and the kids from far. And on the same time, some of our educational teams and therapists went to their houses under attacks or between attacks. And so we will be able to actually connect on the face-to-face level, which is the most important thing for these kids.
I'm sorry. This is bringing me back to all I've experienced back then. I was very fortunate to have been part of the Chimes family during that time, and that Tiago is in their daycare. They were there for us. Chimes called right away. Each of them did. The manager, Moran, the social worker, and others. They made sure to help us in so many ways and helped us evacuate as soon as possible.
When we came back just after the war started, we couldn't have more than 5 kids at a time, so we had to do it in capsules because the rules then were that if they went to sleep, they had to sleep in this room, which you can't do if you have everybody. So we couldn't allow we weren't allowed to let all the children come back at once. So we had to let them come back for a couple of hours each time, which means the kids came maybe 2 or 3 times a week.
We got a permission to go back here and keep working with the children. We saw if we had a progress with the child, he got back, he had a regression in his development. We saw children in stress. We saw children with the eating disorders, with sleeping disorders. We saw children that got back to infant behavior. They start drinking bottles again, stop eating solid.
So what we do is now we have an exercise where I look around and say, Azaka, we don't actually sound siren. And then the kids and the staff come in and they've got to be here within 30 seconds. For one class, it's very easy. For the other class, it's very difficult. You have to walk downstairs, and so we have to carry them. And if they're outside in the playground, then you have to bring them upstairs and then downstairs to get them to this room. So we don't make it in 30 seconds.
The situation today is that, first of all, they practice with the kids the steps of getting to the safe room. Now, whenever Eliran hears sirens, he doesn't yell or panic. They must be working on this with the kids at the daycare. Since joining the daycare, he's much less anxious. He was a boy with many anxieties. He would enter a new room with a physical therapist and scream. He wouldn't cooperate. But here, he's familiar with the staff, who he sees on a daily basis. He sees the same kids, his friends. He knows the rooms, the place itself. That's what gave him the sense of security to progress in his development.
The Ashkelon municipality has granted Chimes Israel land to build and operate a new early childhood center, and plans have been drawn for a building that can accommodate 80 children.
A new center with the shelter will help us to give the children a safe environment so we could give them a treatment they need to help them with development delay. In times of conflict, we can keep the routine they know. And for autistic kids, it's very important to have a routine. And it's also important for the families, because some families, they really need this kind of place. They can bring their children so they get all the treatment they need in one place.
So if we have a place that's really built for their needs, their specific needs, it's gonna first of all lower the anxiety level of the kids, and it'll lower the anxiety level of the staff, who under certain conditions are operating under a lot of pressure.
We're dreaming of a new center that will help us provide all our great people and great skills into one holistic places, which will include first of all a safe room or a shelter, and new and bigger rooms with better equipment, and that we will be able to develop the kids and also professional team training, and we wish to be #1 in the world.
Please donate to enable uninterrupted, high-quality professional services, treatment, education, and support for hundreds of children with disabilities in Ashkelon for years to come. You can give young children with disabilities the start in life that they deserve to reach their potential.